I often speak on nurses transitioning to health information management in general, but today I would like us to look at outpatient clinical documentation improvement, or integrity, and the role of the CDI nurse specifically. So, what are some of the benefits and purpose of an outpatient CDI program? Here are a few benefits. First, to improve provider ownership of clinical documentation to ensure specificity of patient diagnoses, leading to better capture of patients' true severity of illness, code assignment, and resource consumption. Secondly, educate providers on how clinical documentation impacts billing and reimbursement, risk adjustment, data validation, evaluation of quality care, provider ranking, care coordination, medical necessity criteria, Medicare Shared Savings Program, reporting communicable diseases and research. Thirdly, provide a provider-focused education system to foster a CDI proficient culture at the clinician and provider practice levels. Fourth, establish benchmarks and tracking of provider CDI education performance. And lastly, enable CDI data sharing between the following stakeholders and departments: case management, utilization management,
payors,
population health department,
vendors,
compliance department, quality and performance, IT department or data analysts, and of course the finance department. The American Health Information Management Association, AHIMA, suggests CDI professionals track trends in providers' response rates to queries. So, what is a query response? A query response is the documented answer provided by the provider in response to a query issued by a CDI specialist. When a CDI specialist identifies a need for clarification or additional information in a medical record, they issue a query to the provider. The provider's response should address the specific clinical details requested, ensuring accurate and complete documentation. This process is crucial for accurate reimbursement and the overall quality of patient care. So, as a nurse with a background in case management in the outpatient setting, I have collaborated with providers to identify opportunities to close gaps in care. Becoming certified in health information management was a natural transition for me, thanks to the guidance of a mentor who was an experienced and certified nurse coder, and my extensive experience working closely with providers. This means that I was able to leverage my skills as a case manager to understand the fundamentals of health information management. Here are some steps for you to consider if you are interested in transitioning to health information management. Transitioning from a case management nursing role to a CDI specialist involves applying your nursing expertise to ensure accurate and complete medical records. Here are some steps to consider. Understand the CDI role. A clinical documentation specialist, CDS, manages, assesses, and reviews patient medical records. Focus areas include severity of illness, clinical treatment, and documentation accuracy. Outpatient CDI professionals perform prospective and retrospective record reviews, validate diagnosis codes, and query healthcare providers for specifics. Learn on the job. While most hiring facilities seek some form of training, there are no formal qualifications required to become a CDI professional. Certifications are optional, but are the best way to demonstrate to prospective employers that you have an understanding of foundational concepts. Although about 74% of all CDI professionals are nurses, only about 60% hold a certification. If you want a competitive advantage, consider pursuing the Certified Clinical Documentation Specialist (CCDS) or Clinical Documentation Integrity Practitioner (CDIP) certifications. Some provider offices may take nurses from direct patient care roles and train them specifically for CDI roles. Your nursing background equips you well for this transition, and understanding CDI programs' impact is crucial. Certainly, we are eager to support you throughout the process and connect you with a network of health information management professionals, trainers, and mentors who are committed to your success.
We want to hear from you. Schedule a free consultation or send us an email at advancednurses@acd4n.com or visit our websites www.advancednurses.info or www.acd4n.com.